Our names are Maria Castis and Madison McLean, and this is our presentation on diabetic management and the role of telemedicine amid the global pandemic of COVID-19. We're going to go ahead and screen share our poster. All right. When SARS-CoV-2 entered the United States in 2020, extreme precautionary measures had to be taken in order to protect the public, including lockdowns, self-isolation measures, and social distancing strategies. The danger of the global pandemic of COVID-19 also forced a sudden shift in healthcare from patient care predominantly being in person to telemedicine in order to adapt to avoid face-to-face exposure. While many patients did continue to be seen throughout the pandemic, either in person with social distancing or through telemedicine, there were also many patients whose healthcare was directly impacted through missed appointments and unscheduled follow-ups due to the pandemic. Many providers scrambled to strategize how to provide the best care for their patients amid the pandemic, and many turned to telemedicine as a way to manage patients safely. While the sudden and unforeseen change in patient care had many impacts, this study aimed to evaluate both the effects of COVID-19 on diabetic management and the role that telemedicine played in the management of diabetes during the heights of the pandemic. Diabetes is a widespread disease with significant morbidity, and the best care of patients with diabetes is always in need of evaluation and improvement. The forced shift of COVID-19 to implement virtual medicine provided an opportunity to study the potential role that technology could play in the future of medicine. The goal of this study was to collect data from the pandemic in order to evaluate the role of telemedicine in diabetic care in the future.
Our study population was composed of adult type 2 diabetics seen within the Department of Family Medicine at TTU HSC. We conducted a power chart review of these patients seen prior to the COVID pandemic and during the heights of the pandemic. The pre-COVID data was collected from January 2018 to March 3rd, 2020. The data collected during the pandemic was collected from March 4th, 2020 to March 10th, 2021. This was the time when the mask mandate was lifted in Texas. The data showed that of our study population, 55% of patients were considered under control pre-COVID for their diabetes, 36% were considered uncontrolled, and 9% had unknown control status. Of the 55% of patients that were seen that had control of their diabetes prior to COVID-19, only 65% stayed under control during the pandemic, 13% became uncontrolled, and 22% had unknown control due to not having their A1C monitored during the heights of the pandemic. When analyzing the use of telemedicine during the pandemic, the data found that a little less than half of the patients actually used telemedicine during the pandemic, with 46% of patients using telemedicine and 54% did not. When looking specifically at the diabetic control of patients during the pandemic, the data demonstrated that of our total sample size in this study, 47% of patients were under control, 29% were uncontrolled, and 24% had unknown control status. Of the 47% that were in control during the pandemic, 48% were seen only in person, 38% used a combination of in-person and telemedicine appointments, and 11% were seen only with telemedicine. 6% were not seen at all in clinic, but had labs done outside and elsewhere. Of the 29% of patients that were uncontrolled, there were 44% of patients who were seen both in person and with telemedicine, 41% who utilized only in-person appointments, and 9% of patients that were seen only via telemedicine. 6% of these patients were not seen at all, but had labs done elsewhere. Of the 24% of patients with unknown control, 57% of them were not seen in any form of diabetic management, and 43% were seen either with in-person or telemedicine appointments and did not have labs checked during this time. Other important aspects of diabetic management were also analyzed, specifically the frequency of diabetic eye exams and LDL monitoring pre-pandemic versus during the pandemic. Only 28% of patients had a documented eye exam prior to the pandemic, and this decreased to 10% during the pandemic. However, it can be noted that the data for the rate of diabetic eye exams is limited, as ophthalmologist documentation were often completed on a different EMR that does not transfer to the EMR used in this study. When analyzing the monitoring of uh, patients' LDL levels. 75% of patients had documented LDL levels prior to the pandemic, and this number decreased to 50% during the pandemic.
The results of this study demonstrated the significant negative impact that COVID-19 had on the management of diabetes in West Texas. The overall results of this study showed 29% of the total sample population was uncontrolled during COVID-19, and 24% of the total sample population had unknown control. For the 55% of patients who were under control prior to the pandemic, 13% of them lost control over their diabetes, and 22% of them completely fell out of regular patient monitoring during the pandemic. For those who continue to not be under diabetic control or lost their diabetic control, multiple factors such as less opportunity for exercise due to social distancing, increased consumption of food due to being home all day, and less desire to lose weight and make healthy choices due to the stress of the pandemic all probably played a role. For those who did not complete any follow-up appointments during the pandemic, factors such as fear of going to in-person appointments or hesitancy to do telemedicine appointments probably contributed. What is clear for both those with uncontrolled diabetes and those who are not seen for management is that the global pandemic of COVID-19 impacted their regular diabetic maintenance. This study demonstrated that those patients who were seen in person had the best outcome of being under diabetic control during the pandemic. With the 47% of those who were under control during COVID-19, the majority were seen in person at some point during the course of their care, whether that was solely in person or with a combination of in-person care with telemedicine. In-person appointments and telemedicine seem to work hand in hand, as up to 38% of patients who are under control had a combination of both for their diabetic management during the pandemic. There were not many patients who were seen only via telemedicine, so further data on the use of telemedicine as a sole route of diabetic management would need further study. However, these study results indicate telemedicine is an appropriate addition to in-person patient care and can be used for proper management in addition to in-person appointments. In-person appointments, or a combination of in-person appointments with telemedicine, did not completely keep patients under diabetic control. There were also many patients who were seen in person or with a combination of in-person with telemedicine that had uncontrolled diabetes during COVID-19. Of the 29% of patient nation of in-person with telemedicine that had uncontrolled diabetes during COVID-19. Of the 29% of patients who were uncontrolled during the pandemic, the majority were seen either in person or with a combination of in-person and virtual care. This shows that while in-person appointments were important for the 47% who were under control during the pandemic, there was also a profound negative impact of COVID-19 on the overall diabetic management, regardless if patients were seen or not. Of note, the rate of diabetic eye exam checkups and the completion of routine LDL monitoring decreased significantly during the pandemic. The results of this study were limited by the patients who did not utilize telemedicine or in-person exams or appointments during the pandemic and did not have labs completed. Data for diabetic eye exams was also limited, as it was difficult to obtain this data because the Department of Ophthalmology uses a different EMR than the Department of Family Medicine.
In conclusion, COVID-19 negatively affected the diabetic population seen within the Department of Family Medicine at TTU-HSC, with many patients falling out of care or having uncontrolled diabetes. COVID-19 accelerated the use of telemedicine, with almost half of the patients utilizing it for their diabetic care during the pandemic. While in-person appointments are still the most reliable method of patient care, telemedicine can be a tool of enhancement for diabetic management and possibly other chronic diseases when typical in-person care is not an option. Telemedicine also has the potential benefit to those who have limited access to healthcare. For future physicians, it is important to have proper training on the technology, effectiveness, and limitations of telemedicine, as it is likely the future of patient care will include virtual visits in addition to standardized in-person care. Thank you very much for listening to our presentation.